Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. So Leo, what is the harm in extracting large multiple root teeth without creating a flap and leaving them closed by second intention? We've got a similar question here. Should we always close every extraction? And sometimes the doctor leaves it open to drain if it is pus. Should these be closed? So both very similar questions. If we are at this introductory level, that's super common, and I appreciate your questions and I appreciate your honesty in presenting both of these questions. If we have some degree of veterinary dental education, and this is the first exposure that a lot of you have, and this sets the groundwork for going forward, especially on this topic. So from that standpoint, if we're practicing dentistry the way it's supposed to be practiced, the way that AHA says that we should practice it, the way that the American Veterinary Dental College says that we're supposed to be practicing it in veterinary practices around the country, around the world, we have someone or a team of technicians or doctors or both that can do radiographs quickly and efficiently. And by that I mean 8 minutes or less for a small dog, 15 minutes or less for a large dog, with either 10 images or 15 images. That's the first component. The second component is the doctor that can do surgical extractions quickly and efficiently and read the radiographs that the tech or the doctor, or maybe them, take and come up with a diagnosis quickly and go right into the procedure and do surgical extractions by lifting up a flap, which exposes all of the debris that would be left if we just extract the tooth and let the pus drain. There is no pus in most of those extraction sites. There's a lot of food debris, and there's a ton of bone osteomyelitis and infected tissue in the socket where the bone has been lost. But from the standpoint of pus draining, that non-cleaning of those extraction sites does nothing but make the patient feel a little better. You need to be able to go in, surgically extract with flaps, clean, which is the biggest part of the benefit to the patient, close those extraction sites, and then send that patient home disease-free. When we do that, there is zero, and let me reiterate that, zero sepsis from the point of closure forward. If we leave all of that debris, that sepsis continues for months to years, if not the life of that patient. And so the patient still is getting showered continually with bacteria, and this is backed up with research. We know this in humans. We know this from the standpoint of our veterinary patients in certain studies, especially one that was done at Wisconsin that showed the patients do not have sepsis after closure if it's done correctly. So that's the probably the most important point that I want you guys to take home today is that particular thing. We're not doing these patients any good by cleaning teeth, and that's all we're doing. We're not doing these patients any good from a long-term and a sepsis standpoint and a healing standpoint quickly by extracting teeth and leaving the extraction sites open. Now, there is an exception to that. So let me go to these slides here and I'll show you what that exception is. When we extract an incisor and there's no inflammation, let's say it's a fractured incisor, maybe you've got a couple of fractured incisors there, but there's no gingivitis, there's no bone loss, the dog had fractured it from some other means and you're extracting it because the pulp's exposed and it will either die or it's dead already. In those cases, there's no need to close the extraction site. You're going to create more trauma, to close an extraction site where there is no inflammation in the incisor area than you will just leaving a blood clot in there and letting it heal by second intention, where that gingiva will grow over that and it will look like normal and will be normal gingiva over a solid bone replacement of that bone graft or that blood clot. And blood clot meaning blood clots or bone grafts. So that's all you need to do. Leave a nice blood clot in there, leave it open, and that will heal probably better than your flap in that case. But if you have this that you're looking at here, where you've got periodontal disease, you've got all that fimbriated gingiva, you've got inflammation around the edge, and you're extracting multiple teeth, sometimes one tooth even, that's got a lot of inflammation. What you want to do is take your diamond football burr and you want to go down into that alveolus. You want to clean it out really nicely, and then once that's done, you can make these margins nice and straight and clean with your scissors, and then close that with simple interrupted sutures. And with a dog, a small dog and cat, we use 5/0 monocryl on a P3 needle. In a large dog or cat, in a large dog, we use 4/0 monocryl on a PS2 or PS3 needle. And those are cutting needles, they're not taper needles, and any cutting needle is a reverse cutting needle. So the cutting part is on the back side, the convex side of that needle. If it says cutting, it's still cutting on the back side. So cutting or reverse cutting needles so that you don't pull through the tissue if you've got the cutting part on the other side, or you're trying to drag it through that tissue. Taper does not work, despite what some people are doing in dentistry and even some specialists. It is absolutely terrible from the standpoint of tissue management and efficiency in getting that tapered needle through, unless it's a super small taper. So that being said, let's go to the next. Any tips for extractions where there's ankylosis or resorption to help breaking root tips? Ankylosis and resorption. So resorption we can kind of put on the back burner. We'll talk about that with tooth resorption. Resorption doesn't need to be extracted if there's complete replacement resorption. We've got another discussion on that later. But when you're looking at preventing breaking root tips, there's a couple things you can do. Number one, you should have proper training. You need to be able to be comfortable removing vestibular bone to the point where you can make a good assessment of the outline of that tooth. You can see the mesial and distal tooth and bone interface from that exposure with the vestibular bone removal with your diamond football burr, and then making those grooves that are deep enough but not too deep, and then using nice sharp elevators in order to get that accomplished. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.